Welcome to this educational video about bladder papilloma. A bladder papilloma is a non-cancerous or benign growth that develops on the inner lining of the bladder. These growths, resembling small, wart-like bumps, are generally not life-threatening but can cause discomfort and, in some cases, require medical intervention. In this video, we'll explore the causes, symptoms, diagnosis, and treatment of bladder papilloma, providing a comprehensive overview of this common condition. The exact cause of bladder papillomas isn't always clear. However, several factors are believed to increase the risk of developing these growths. Smoking is a major risk factor, with chemicals in tobacco smoke irritating the bladder lining. Exposure to certain industrial chemicals, particularly aromatic amines used in the dye rubber, leather, and textile industries, has also been linked to increased risk. Chronic bladder infections or inflammation may also play a role. In some cases, the cause remains unknown, referred to as idiopathic. Pathophysiologically, bladder papillomas arise from the transitional cells that line the bladder. These cells normally divide and regenerate in a controlled manner. However, in the case of papilloma formation, these cells undergo abnormal proliferation, resulting in the formation of a small, wart-like tumor. While these tumors are typically benign, meaning they don't invade surrounding tissues or spread to distant sites, they can still cause problems by irritating the bladder lining and potentially leading to bleeding or urinary obstruction. Over time, some bladder papillomas can potentially develop into cancerous tumors if left untreated. Bladder papillomas are relatively common, affecting both men and women. However, they are more frequently diagnosed in men, especially those over the age of 50. Smokers are at a significantly higher risk. Individuals working in industries with exposure to aromatic amines, such as those involved in dye manufacturing or rubber production, also have an elevated risk. The incidence of bladder papilloma is influenced by factors like age, gender, smoking habits, and occupational exposures. Many bladder papillomas are asymptomatic and discovered incidentally during routine medical examinations or investigations for other conditions. However, when symptoms do occur, the most common is hematuria, or blood in the urine. This can range from microscopic hematuria, only detectable under a microscope, to gross hematuria, where the urine appears pink or red. Other potential symptoms include increased urinary frequency, urgency, and dysuria or painful urination. In rare cases, large papillomas can obstruct the flow of urine, leading to urinary retention or kidney damage. Diagnosing bladder papilloma typically involves a combination of tests and procedures. A urine analysis is usually performed to check for blood or abnormal cells. A cystoscopy, a procedure where a thin, flexible tube with a camera is inserted into the bladder, allows the doctor to visualize the bladder lining and identify any growths. If a papilloma is detected, a biopsy is usually performed to examine the tissue under a microscope, and if it is benign or malignant, imaging tests, such as a CT scan or MRI, may also be used to assess the extent of the tumor and rule out any spread to other organs. While bladder papillomas are generally considered benign, they can be classified based on their appearance and growth patterns. Some are solitary, meaning there's only one growth, while others are multiple. They can also be categorized based on their size and location within the bladder. The most important distinction is whether the papilloma is non-invasive or invasive. Non-invasive papillomas are confined to the inner lining of the bladder, while invasive papillomas have spread into deeper layers of the bladder wall. Papillomas can also be classified as low-grade or high-grade based on the appearance of the cells under a microscope, with high-grade papillomas having a higher risk of progressing to cancer. The treatment for bladder papilloma depends on several factors, including the size, number, and location of the growths, as well as the patient's overall health. The most common treatment is transurethral resection of bladder tumor, or TURBT. This involves inserting a resectoscope, a specialized instrument with a cutting loop, through the urethra and into the bladder to remove the papilloma. Following TURBT, intravesical therapy, which involves instilling medication directly into the bladder, may be used to prevent recurrence. These medications can include chemotherapy drugs or immunotherapy agents like BCG. Regular follow-up cystoscopies are essential to monitor for recurrence and detect any potential cancerous changes early on. In cases where the papilloma is aggressive or has a high risk of recurrence, more extensive surgery, such as a partial or radical cystectomy, may be necessary. While it's not always possible to prevent bladder papilloma, several lifestyle changes can reduce your risk. The most important is to quit smoking and avoid exposure to secondhand smoke. Protecting yourself from exposure to industrial chemicals, especially aromatic amines, is also crucial. This may involve wearing protective clothing and following safety guidelines in the workplace. Maintaining a healthy diet, staying hydrated, and avoiding chronic bladder infections can also contribute to overall bladder health and potentially reduce the risk of papilloma formation. The prognosis for bladder papilloma is generally good, especially if the growths are detected and treated early. However, recurrence is common, so regular follow-up is essential. Recent research has focused on developing more effective intravesical therapies and identifying biomarkers that can predict the risk of recurrence or progression to cancer. Studies are also exploring the role of genetics and the immune system in the development of bladder papillomas. Advances in imaging techniques, such as narrow band imaging and fluorescent cystoscopy, are helping doctors to better visualize and identify these growths during cystoscopy, leading to earlier diagnosis and treatment. Ongoing research is continually improving our understanding of bladder papilloma and leading to more effective treatment strategies.